Hello,
Good
everyone.
afternoon. Oh, I'm sorry, Josephine. Let me introduce you. Good afternoon and welcome to the launch of the Fluoride for Texas website and today's webinar entitled Community Water Fluoridation Communication, Lessons Learned from the Texas Fluoridation Campaign. I'm Beth Stewart, and on behalf of the Texas Oral Health Coalition, we're proud to share the results of this two-year project developed in collaboration with the University of Texas Center for Health Communication, and the Texas Health Institute through the generous support by the Delta Dental Community Care Foundation. Our presenter today is Dr. Josephine Ortiz Wolf, who is an assistant professor at A.T. Still University within the College of Graduate Health Studies. Dr. Wolf served as the Oral Health Program Director for the Texas Health Institute and has an in-depth knowledge of the research analysis and communication strategies developed for this campaign. Dr. Wolf earned an undergraduate degree in dental hygiene from the University of Texas Health Science Center at San Antonio, is a certified health education specialist, and a National Health Service Corps Scholar alumni. Dr. Wolf received a Master of Science degree and her doctoral degree in public health from Walden University, where community health education, health promotion was her area of study. She currently serves as chairperson for the American Public Health Association's Oral Health Section and is also a member of the Speakers Bureau for the American Association of Public Health Dentistry. I'm very pleased to have my friend and colleague provide this presentation for you today. And welcome, Dr. Josephine Wolf.
Thank you, Beth. Hi, everyone. Thank you so much for joining us today. We are very excited to be sharing with you today the launch of the Fluoride for Texas website. So as Beth mentioned, we want to, let's see here. Here we go. I wanted to acknowledge a few of our partners before we begin. The Texas Oral Health Coalition, a nonpartisan state level oral health coalition. Also, the Center for Health Communications at the University of Texas. The Center for Health Communications is a joint academic center of both the Moody College of Communication and Dell Medical School. And also acknowledge our partner, the Texas Health Institute. The Texas Health Institute is an independent, nonprofit, nonpartisan public health institute in Texas. So before we begin, I just wanted to give you a little bit of an outline of our presentation. First, we're going to be discussing some of the background to our project. We'll be reviewing the formative research, the insights, the strategies, and then most excited about reviewing the resources that we have developed over the two-year period. So before we get started, I wanted to kind of introduce everybody to the main mission and goals of the campaign. We knew that by understanding how fluoride hesitant beliefs are constructed, we had a better chance of deconstructing them. One of the main goals of this campaign was to get a better understanding of fluoride hesitant sentiment in Texas. We also wanted to develop data-driven messages aimed at communicating the benefits of community water fluoridation. And most importantly, provide resources for the community by coordinating the dissemination of messages to targeted populations. Before we get started, I just wanted to mention that there's a few different types of fluoride. There's in-office fluoride, so the fluoride that you would get at your dental office. There's the fluoride that you can get at home through toothpaste, mouthwash, things like this. But what we're talking about today is specifically community water fluoridation. This is the fluoride that comes through, say, a person's tap or faucet in their home. So a little bit of background about Texas and the landscape here in Texas. We are very proud that we have a very good utilization of dental benefits through the Medicaid enrolled children. In fact, we are one of the top in the nation for the percentage of Medicaid enrolled children that are making dental visits. This is important because we know Medicaid enrolled children experience disproportionate rates of dental disease. So we are glad that we're getting them to the dentist. But interestingly enough, Texas still ranks 39th out of the 41 states in the number of third graders who have experienced dental caries. And even though dental decay is almost completely preventable, 67% of our children have some sort of history of dental decay in their baby teeth or primary teeth. So this leads us to think there's a high rate of children going to the dentist, but yet Texas has one of the highest rates of decay. Well, something wasn't quite adding up there. And what we realized is we recognized that there was a need. We need a multidimensional approach to oral health. And community water fluoridation was a valuable tool in our armamentarium. We knew that we needed to address dental decay from several different aspects, not just access to dental care, but community water fluoridation is a proven method to prevent dental decay. So we began our campaign and our research study. This slide comes from our partners at the Center for Health Communication. And this is how they like to describe the message design process: research, insight, strategy, and tactics. And as we go through our presentation today, we'll touch briefly on each of those. So one of the first things that we did is we gained some research. We really looked at the background of and the landscape of the information we already had. So we collected existing community water fluoridation resources and data. We looked at both the resources available in Texas and also through the national data, such as the CDC water fluoridation reporting system. And we really focused on three different things. The first thing that we did is we gathered existing communication resources on relevant topics through social media. We also performed quantitative research as some of our background research. We surveyed water operators and also some qualitative research in which we performed key informant interviews with dental and dental hygiene school faculty. And we're going to talk a little bit about each of those just briefly. So our social media data mining tool that was used was called Nuvi. It's just a software and it sort of collects trends and words and topics across social media platforms, specifically Twitter. And we use this to really get an understanding of what was being said and who was saying it and where these messages were coming from. We're not going to talk about it too much today in detail, but we do have a publication in the Journal of Public Health Dentistry that goes into detail and discusses this particular data collecting tool and the research and the results, entitled Social Media Conversations About Community Water Fluoridation, Formative Research to Guide Health Communication. So I strongly recommend that you look that up. It's very interesting, some of the things that we discovered here. Moving on, we also conducted quantitative research. One of the first things that we did is we surveyed water operators. We wanted to get a better understanding of their beliefs and their attitudes and some of the knowledge that they had. One of the main questions that we asked them was, where do you go for information about water fluoridation? And we were pleased to see that the majority of them were looking at public health experts, professional organizations, or federal and state regulatory agencies. And really very few were looking at social media or other friends and family or things like this. And we'll talk about why that's important here in a bit. We also spoke with dental and dental hygiene school faculty. And what we wanted to know is what was currently being taught in the curriculum, and were there any challenges or was there any resources that they would like to have? And one of the things that we found was that the faculty felt it was very important for students to understand the history surrounding community water fluoridation. They also said that they discuss how to address fluoride hesitant sentiments, but not necessarily discuss how to communicate about community water fluoridation as a preventive measure. And one of the most requested items was a communication toolkit to help students communicate about water fluoridation. Simulations and dialogues were really one of the things that came up the most. So with this background research, we created, as researchers do, a logic model to really guide our actions moving forward. We identified three main audiences: medical and dental professionals, oral health policy advocates, and Texas parents, as those were the groups that we found through our background research that were really talking or interested in community water fluoridation. For all three of these, we created different desired actions, but there was one main outcome for all three audiences, and that was to increase the use of public water fluoridation, and also to create a proactive foundational support for fluoridation at the ready in case a crisis or it arose in their particular community. And so with that, we moved on to the insight process of our message design process. So we talked a little bit about some of the audience surveys that we conducted. Really, one of the main data collection, the meat of our campaign, was a messaging survey that we conducted. The key and the goal behind this messaging survey is we wanted to know what is important about what they think about community water fluoridation. And we were looking at Texas parents, general audiences, and we wanted to know behaviors surrounding community water fluoridation. We also conducted a concept survey, which we'll talk about at the very end of this presentation. But let's move on and have a little bit of a review of our message survey. So the message survey, the reason this was important to us is because we know that community water fluoridation is important to overall health and dental health, but it was unclear what benefits we should highlight in health messages to effectively increase community support for community water fluoridation. So we conducted a messaging survey. Our sample population consisted of an N of 266, so 266 participants. Most of our participants were female, and most of our participants reported as white. Most of our participants, 82%, reported living in an urban zip code, incomes over 50,000, and the mode, or the most common number of children that our participants had, was 3. And 80% of our population had, the mode was 2, and 80% of our population had 3 or less children. This is important because I think this is pretty representative of a patient that we would see in our practices, or maybe someone else that we know that may be concerned about community water fluoridation. Let's talk a little bit about the methods to our study. So, of course, after providing informed consent, our participants completed some preliminary measures, including demographic. We asked them about their normative beliefs and their personal beliefs before reviewing any of our community water fluoridation benefit messages. So there was a total of 21 messages, each varying with their terms of focus. 6 messages were viewed by all the participants, and 7 messages were randomly assigned to the participants. The messages were grouped according to their main focus. So the main focuses were improving oral health, contracting inequities in oral health and access to care, affirming fluoride safety, improving social well-being, and cost savings of fluoridated water. We had essentially 2 research questions. The first research question, do the messages about oral health, cost, social well-being, health equity, and safety lead to support of community water fluoridation messages? So we had essentially 3 hypotheses, or 3 hypotheses that we had at the beginning of the study. And we hypothesized that personal perceptions, of community water fluoridation would positively predict support for our messages, while we also said concerns about community water fluoridation would probably negatively predict support for our messages. And the normative beliefs regarding how relevant others view the benefits, we hypothesized that that would positively predict support. Our second research question is we really looked at the patterns. We wanted to know, do the patterns of these effects different across the message themes? Okay, so we had our independent and dependent variables. Our independent variables included the normative beliefs, the personal beliefs, and the demographic factors, where our dependent variables were those messages could support for community water fluoridation was measured with a specific item asking about the likelihood that each of the community water fluoridation benefit statements would earn participants' support. And those responses were measured on a 5-point scale ranging from very unlikely to likely. So for the four items that measured formative beliefs, those were measured from strongly disagree, number 1, to strongly disagree, number 5. And remember, the normative beliefs are people in my family, people in my community, my doctor, my dentist. Normative beliefs are individuals' beliefs about the extent to which other people who are important to them think they should or should not perform a specific behavior. And normative beliefs aid us in predicting other variables as well, which is why it was important that we look at this. So for question number 1, we ran 2 mixed effect regression models with each of the message types as a predictor variable. Remember, regression models are just really a way to sort out variables that have an impact on our question, our research question, or which factors matter the most, which factors we can actually ignore, and perhaps the most important thing is how certain we are about all of these factors. So it's just a way of comparing 2 different things. Our first model compared community water support ratings for oral health messages, and the second model compared personal well-being messages. Okay, so our results. The model with oral health messages really showed no significant differences between the messages focusing on community water protecting teeth and messages looking at community water fluoridation's role in improving health equity. Also, there was really no differences between the messages focused on oral health and those focused on safety of fluoride. But in contrast, the messages which focused on cost savings, as well as those that focus on the relationship between community water fluoridation and social well-being, significantly decreased support for community water fluoridation compared to the oral health messages. And the model with social well-being, so this is social well-being as an individual well-being. The model with social well-being as the comparison message group also confirmed the previous results, which indicated that equity messages significantly increased community water fluoridation support compared with social well-being messages. So social well-being, the individual well-being, the equity messages, which equity for community, those messages supported or increased support for the community water fluoridation messages. So this is an important finding as well. And then that moves us on to research question number 2. And here we ran a series of regression models as well. The mean of community water fluoridation support for each message was that dependent variable. And the goal for this particular model was whether support for the specific messages was predicted by personal normative belief about community water fluoridation. So again, we were looking to see if specific message types was predictive by personal and normative beliefs about the benefits of community water fluoridation. And what we found there was really interesting. It showed that the perceived benefit was positively associated with community water fluoridation on all messages. However, the relationship perceived of risks and community water fluoridation support was not significant for any of the message types. So the results for the normative belief variables provided partial support for our hypothesis number 3. So it's really dependent. The relationship between community norms and dentist norms beliefs was not significantly related to support for any community message or any message group. However, the perception that one's family doctor believes community water fluoridation was positively predictive for community water support in all messages. So what's important here to point out is that there is an important interprofessional practice component to community water fluoridation. Utilizing our colleagues in family practices to help promote community water fluoridation would appear to be a positively associated result. The result of family norms, those varied across the community water fluoridation benefits. So while family norm beliefs were positively associated with oral health, safety, and cost, they did not associate with any support for equity or the social well-being messages. Okay, so those were the results from the study. But what does all of that really mean for the campaign? Well, let's kind of break it down for you. Let's look at kind of the some of the main pieces of information that we got from our survey. So when we asked folks, what is the water in your home fluoridated? We found that the majority of the individuals that responded to our survey did not know if their water was fluoridated, 48% in fact. And when we asked them, have you ever thought about community water fluoridation before today? And it was almost half and half. 51% said yes, 49 said no. And then when we asked, have you come across information about community water fluoridation in the media or online? Again, we were at about half and half, slightly more no's than yes. And when we asked them, in your home, does anyone use any of the following? We actually had a very high percentage of individuals say they use fluoridated toothpaste. Almost a little more than half used some type of fluoridated mouthwash. A very small percentage did not use any fluoridated products at all, which really led us to believe that our sample population did not have a hesitancy towards community or towards fluoride in general. When we talked about water sources, when we asked to check all that apply, we looked at bottled water, tap water, other filtered water, and pitcher-based. We found that the majority were using some type of bottled water, and tap water from the faucet was about a quarter, and other related filtered waters, we're assuming that is something like maybe a refrigerator or a filtration system at home, and then pitcher-based filtered water is 14%. And then the next question, this was very important as we formulated our project moving forward. When I think about community water fluoridation, I feel the options were curious, optimistic, hopeful, anxious, fearful, and angry. And we see here that the curious, optimistic, and hopeful were much higher than the anxious, fearful, and angry. So the percentages for curious, optimistic, and hopeful in our sample population reported much higher than those that were anxious, fearful, or angry. Okay, so remember we compared the belief statements to support of the messages. When we looked at the belief statements, here's what we found as the mean. So just really quick, I wanted to point out that it was ranked from 1 to 5, but the mean or the neutral number here would be 3. So when we look at the mean, which is the average of the responses, the two that ranked towards the top where I believe that oral health is an important part of overall health. And number two, I trust the advice and information I receive from my dental professionals. So this gave us really the foundation for how we were going to move forward with the project. We were very pleased to see that oral health is very much connected to overall health, and clearly our population sample trusted dental professionals. You can see there right under dental professionals is medical professionals. So the mean of 3.79 and a mean of 3.71, both very close there. And when we look at the messages, remember we compared those normative beliefs to the oral health messages. And we're not going to go over all of these. I just want to point out a couple of them so we kind of bring the big picture of that research study together. We looked at oral health. So one of the ones that ranked the highest was water fluoridation boosts your family's protection against tooth decay by 25% or more, saving you money on potentially costly dental treatments. So this had a mean of 3.67 and a standard deviation of 0.99. So remember, your standard deviation is how far from the mean most of the measurements are. So since we were measuring 1, 2, 3, 4, and 5, our standard deviation here was 9, which meant that we can, most of our folks strongly agreed or strongly agreed with this statement. Equity also ranked very high with a mean of 3.66. Water fluoridation benefits everyone. And it helps people of all ages and incomes, especially people who cannot see the dentist regularly. And remember, that was that equity one that we talked about. And then remember how we talked about that maybe some of the well-being messages did not score as highly, and you can kind of see there those towards the bottom. And some of the other ones that we highlighted, their mean is higher, so they scored higher. Okay, so the next question that I think would be of interest to the group is, who do you trust to receive information about oral health and water fluoridation? And 199 ranked dentists and dental hygienists as one of the top that they would trust to receive oral health and water fluoridation information, as well as our medical professionals, our doctors, meaning physicians and nurses, also ranked very highly as well. And when we looked at normative beliefs, right, normative beliefs, we talked about that a little bit. We looked at, my family doctor thinks fluoride is a good thing, and that mean was 3.46, and my dentist thinks fluoridation is a good thing, and that mean was 3.6. But when we looked at how that influenced the messages ranked higher for those who thought the doctor supported community water fluoridation. So they showed more support in that area. And then when we looked at personal beliefs, I trust the evidence and information I receive from medical professionals, 3.71. I trust the advice and information I receive from dental professionals, 3.79. And I believe oral health is an important part of overall health, 4.17. So those were significant personal means as well. Okay, so just to summarize everything here, essentially the messages that promoted oral health and community health did a lot better than those that focused on, say, safety or cost savings or a personal social well-being. Participants, we found, trust the advice that they get from their medical and dental professionals. And most of our participants were curious about community water fluoridation. Although they had not thought about it too much, they were really curious and optimistic. We only touched on a small portion of the results from our study, but we're happy to report that there will be a future publication in the Journal of American Dental Association coming soon. So if you're interested in learning more about that study and reading the details and looking at some of the data, we encourage you to look out for that publication. Okay, so what did our population really think about community water fluoridation, right? We talked about that a little bit. They were curious, they were optimistic, but they really didn't think about it so much. But remember, We wanted them to think about community water fluoridation. That was the purpose of our campaign. We want them to understand that drinking fluoridated water is just one of the other positive health behaviors that they should be engaging in, just like changing your smoke detectors or scheduling your dental visits regularly. We wanted them to be ready to support community water fluoridation just in case the issue were to come up in their community. And we also wanted them to be well prepared to advocate for the benefits of community water fluoridation. So this moved us on to our next strategy. We did all of this research, and now we're ready to move on to the next step in our process. And keep in mind, up to this point, we have not created any health messages or attempted to create any message at this point. We used all of the information that we gathered to come up with this kind of audience or a key message template where we identified our purpose, our key message, our audience, our objectives, and our tone. We wanted to be specific about what we were promoting, what was the sell, whom were we selling. So our overall purpose was a proactive public support for community water fluoridation in Texas. Our key message was that drinking fluoridated water was an important part of overall health. We developed a key persona as we were developing these messages. The persona that we were always trying to target that we created was Andrea. And Andrea was a 37-year-old mother of two. So as we created our messages, we always thought, well, how would Andrea support this message? Or what would Andrea feel or think about this message? The objective is that we wanted viewers to visit the website and also to learn more about community water fluoridation. And the tone here, this is very important. Our research clearly led us in the direction of no scare tactics. And we were not focused on addressing any anti-fluoridation hesitancy or messages. We were only focused on preventive benefits of drinking water fluoridation. So we only focused on the positive. With that, the Center for Health Communication helped us to see that there was very different ways to address or to create these communication models based on the appeal. So I'm going to review just a few of them here. One of them was the general emotional appeal. And these are kind of two samples of what those look like. The emotional appeal, fluoride makes mouth stronger. Fluoride makes smiling easier. Drinking water fluoridation makes mouths happy. Like that's the general emotional appeal of an ad. Another one is a visual metaphor. This could also be related to smoke alarms are a primary protective factor where the fire department is a backup protective factor. Or sometimes we compare community water fluoridation to an added feature of safety like seat belts compared to airbags. You know, you need them both when you get in your car, you put your seatbelt on, but it's also good that you have airbags because it adds protection. So those visual metaphors that we can visualize were another concept that could have been used. General oral health tips. I think this is the one we see a lot in oral health. Those are the ones that tell us percentages and try to relay data. So drinking water fluoridation is one of the many ways that you can protect your family's oral health. The average 11-year-old only brushes 50% of their surfaces of their teeth. These are the general oral health tips. And then there's that type of campaign or message that brings something to mind without any words or without you really thinking. So here is where we wanted that protective factor without thinking about it. So for example, these two pictures might make you think of either insurance or a beer without even thinking. That just automatically comes to your mind. So drinking water fluoridation is something that's healthy for you. It it's does not require any goal setting or list making or making appointments. It's just something that you do automatically. So that's the concept behind this particular type of message. So with all that in our tool belt, we now began to actually develop the messages. And here are the first 5 messages that we developed. These were based on the research that we conducted. We looked at which themes would be more likely to gain support from individuals. And we developed and expanded on those themes. You can see here the one with the lady smiling, that would be a visual. It might be hard to tell, but there's a little soda glass there with a straw in it. And then we have the healthy smiles don't have to hide. That's more of that emotional appeal as well. And the one up in the upper right with the 4 circles, that was really more of the community health equity approach as well. And so with these, remember we talked about the survey that was conducted after that main survey. So the next thing that we did is we then surveyed a population based on these specific messages. So we started with about 10 to 15 of those, and we narrowed them down to the 5 that I just showed you. And with those 5, we tested those 5 concepts. There was initially, or essentially there was 10 different concepts that were tested. 5 of them had a message or a logo attached to them, and the other 5 did not. And this is what we looked at when we looked at those concepts. We measured things like attitude towards the ad or attitude towards the message, the likelihood of sharing that message or that ad, attention to the ad, and did it cause somebody to become defensive? Did it cause somebody to seek additional information? And then we also looked at source credibility, which related directly to those logos that we put on those ads. And these are the 2 that ended up faring the best or scoring the best out of all of the 5 messages and the 10 with 5 with the logo and 5 without. And so what we found was that these 2 scored well in the sharing, source credibility, and the information processing. The information was accurate. It did not exaggerate any of the benefits. So those are some of the results that we got. Also, for this first one here on top, oral health and benefits all were key themes that caused support for this. And we saw that those directly related to that survey that we conducted to find out which messages would garner greater support. The one on the bottom, my kids went to camp for 5 days, but their toothbrush did not. That one really did well because it reached the target population. Folks could relate to that message. And also it provided that extra layer of protection. Also, and overall oral health messages also tested well with our first survey. So this is, again, the design process that we started with. And I wanted to point out that although this is how we like to describe the design process, it actually went a little more like this. It was not as linear. There were a lot of different aspects and actions that we were looking at one time. What was very important about this is that we did not start creating any messages until we really had all of our research and we had really taken a very good in-depth look at our audience. I wanted to share just a couple of key takeaways from this study. Some of the things that we learned early on is to do the work, to know your audience. And it's very important not to make any assumptions about what your audience may or may not think. Have a specific purpose and a message. We were very careful not to be too broad in our messaging. We had a very specific purpose and a very specific message that we wanted to deliver to our population. Also recognize your bias and be prepared to let those preconceived ideas go. When we entered the campaign, we all had ideas about what we thought should be the message. But through the research and through the data, it really gave us the power to make the correct decisions and to focus on exactly those variables that needed to be focused on. There's a very interesting article that I came across just recently, and it's called Developing Public Health Communication Strategies and Combating Misinformation, specifically during COVID-19, but the topics here can relate to any sort of health communication campaign. And it was really just understanding your audience, communicating uncertainty clearly, not over or under assuring your population. Providing numbers, context, and history is important, and telling people what they can and cannot do. And also being aware of the conversations by doing things like watching social media. I thought that all of these really briefed and discussed and sort of described our whole nature of our campaign. But I recommend that as an additional piece of or an additional piece of information or resource that folks can look up if they choose. Okay, so just briefly again, some of the things that we learned here, and these can be applied to your clinical communication as well, is to focus on the positive, keep things simple, understand your audience, stick to one point, and do not create new points of distrust. Public health communications operate on the principle of transparency, reliability, and trust. And those are important messages to keep up. We're not going to get into the communication tips and trainings today, but I'll show you in a second if anybody is interested in a deeper dive into specific health communication training and tips, we can help with that. Now, let's just go back to the very beginning and let's revisit our campaign missions and goals. Remember, we wanted to get a better understanding of fluoride hazard beliefs. And we did that. We got a very good understanding of the beliefs. And then we also wanted to develop data-driven messages aimed at communicating the benefits of community water fluoridation. Well, we sure did collect a lot of data that helped us to create those messages. The next thing we wanted to do is coordinate and disseminate the message to target populations. And that is where we are now. And it is our pleasure. Now we would like to show you some of the toolkits that we have provided. So some of the deliverables from this project, we've developed data-driven social media messages for dental and medical providers, resources for dental educators, and also health educators, not just dental educators, infographics of community water fluoridation data, and also, as we talked about briefly, tailored community water fluoridation communication trainings, which are available to anyone upon request. So with that, I am very pleased to share with you our Fluoride for Texas website. I'm going to stop my share now, and I'm going to switch over to sharing my site with the Fluoride for Texas site. So give me 1 second. Okay. So everyone should be able to see my screen here. The Fluoride for Texas website. We have a lot of exciting things to show you here. The website is fluoridefortexas.org. There are 4 main buttons here. One of them is Learn More, Spread the Word, Take Action, and Resources. We're going to start from the very top, from the very beginning here, under Learn More. So if you want to learn more about the campaign, there's a tab here that'll talk to you a little bit more about the campaign and give you a few details. We're going to go over here to this interactive health data dashboard. This is very, very exciting and useful. It provides community water fluoridation live reports that you can use to advocate in your community for water fluoridation. Let's go back up here. We also have a health communication virtual learning series. So these also provide continuing education and provide some recorded learning specifically about communication. But here's what we're super excited to share with you. Here under the Spread the Word tab, we have here the Health Professional Toolkits, Social Media Toolkits, and Advocate Toolkits as well. So I'm going to begin by clicking on the Social Media Toolkits, and it's going to take us down here. So here we have a toolkit for patient conversations. So maybe you want to learn how to talk to your patients better about community water fluoridation. You can download this guide, and it has a wealth of helpful information, all of which was developed using the data that we collected. We also have an in-office slideshow that you can download and share in your medical or dental practice. All of these slideshows are also available in both English and in Spanish. And they come in either an MP3, a PowerPoint. So it's completely up to you how you want to share them. We also have a social media toolkit. Now I'm going to click on this so that we can see some of the messages that were developed based on the ones that we tested. So you can see that these have actually changed a little bit. Water with fluoride helps smiles stay healthy for life. We can also look at the Spanish version. Here we go. Agua con fluoruro mantiene las sonrisas saludables por toda la vida. So this one you can share with your populations if you have a Spanish-speaking population. Let's switch over back to our website. Okay. And so you can see how some of the messages that were originally tested were refined yet again based on the data that we received. All of these messages are available in both English and Spanish, and these particular messages here are under the share on social media. They not only provide the graphic or the visual, but we also provide you with the text in which you can share with your audience as well. Let's go back up here and let's click on, let's go to the next tab. So under Spread the Word, we're going to go to the Advocate Toolkit. So here under the Advocate Toolkit, we provide a advocacy conversation guide that can help individuals with talking points should community water fluoridation in their particular community come up. So this is available also to anyone and can be used in connection with the interactive health data dashboard to provide a specific story that you can create about your own community. We're going to come back up here to the patient or to the professional toolkits under Spread the Word, and I want to show you a couple of other things just in case we have some educators on the call today. We have a faculty curriculum guide. And here, what we do is we provide just some helpful tips or some helpful items that you can incorporate into your existing curriculum that will help you communicate to your students the importance of communicating properly about community water fluoridation. And this is available to any faculty, and it can be tailored to undergraduate students, maybe at the community college level, right up through students that are maybe dental students or graduate students, and not just dental students, but medical, nursing, any student. And then last but not least, we have here the Texas Fluoridation Campaign request. If you would like to request a training specifically on expanding upon how to communicate about community water fluoridation with your patients or with your community, you can request that here, and we can offer that to you at no cost. So this is our Fluoride for Texas website. We have another quick toolkit here that I want to take you to. It's the Take Action button, and it provides you with a few tools that you can use should you want to take action. And then one last thing I want to show you is our advocate resources. So if we click on this, again, it takes you to a wealth of advocacy toolkits that have already been created. We collected the best of those toolkits and brought them together here on our website. And we hope that you can use these toolkits in addition to the new toolkits that we have created to advocate for your community. That I will stop sharing my screen now. And that concludes my portion of this presentation, but we will now open up the presentation to any questions that the group may have.
Well, thank you, Josephine. You did a great job. I know a lot of times talking about data and research and all can get a little dry, but you put it together very well. And I hope everyone understood a lot of the takeaways, because there was some enlightening moments for me. You know, we went in, and I know I personally thought one way that people would react to or answer their surveys a particular way. So I was rather shocked. I've been used to having to write about or respond to negative comments on social media or things like that about community water fluoridation. So it was enlightening to know, don't go there, really try to take the positive only approach, and then to make it more about community health, what this is doing for the community, and not even as much as so personal. I do want to encourage you all to really go through the website and look at it. Let's see, Effie writes, will TechSoc be posting these social media posts for us to share? Yes, we certainly will. We actually will be starting a campaign shortly, beginning today or tomorrow, and we'll be posting these regularly. We'll also be posting them in Spanish, so you can share to whatever audience you wish to reach.
Yes,
Let's see, so Twitter, social media, yeah. Go ahead, Josephine.
Everyone to share across their social media platforms. We saw through our research that our community trusts our medical and our dental providers, and they actually look to us to provide them with accurate information. So we strongly encourage you to share either the ones that we are posting, or if you want to share your own, you can go straight to the social media toolkit, download the one you want to share, and we even provide you with that text. Yeah.
Are these images in the public domain? Could they be modified for use in other states?
That's a great question. Thanks for asking. And that actually came up quite a bit in our discussion as we were developing the messages. So remember that survey kind of number 3 that we talked about, where we tested those messages with and without the logo. One of the reasons that we chose to design the message the way it was designed was so that it could be shared across all states. So it's not only applicable to Texas, but the message is applicable to any community or population. You are welcome to use the images. And we ask that they don't necessarily be modified because we have put a lot of work into everything from even color theory. We looked at what colors evoke different types of responses. We also looked at what words we should use. If you notice, one of the messages that we tested said, um, um, my child went to camp, but their toothbrush did not. That original message said something like, kids aren't perfect. But then when we tested that, we found out that maybe that wasn't the best way to say this particular or to deliver that particular message. So we changed it. So the messages that were created and the messages that are provided to you are the ones with the sound data backing them up. But you are welcome to use them and share them. And if you want to create your own text with them, that is absolutely fine.
Kurt asks, your audience was primarily white in Portland's failed fluoridation campaign in 2012. Let me open it up here.
Yeah, I can open it. So your audience was primarily white. In Portland's failed fluoridation campaign in 2012 to 2013, 80% of some surveys of people of color voted against fluoridation. Essentially, they voted against their own best interests. Very frustrating. Yes, I agree. Have you targeted messaging surveys with only the Texas Latinx population? So for this particular, that's a great question, Kurt. And for this particular survey and for this level, this phase of our research, we really tried to get a sample population that we could make generalizations about the overall population. And what we learned here was we were really trying to gather the idea of who was thinking about community water fluoridation. Although one of the things that we did identify is that that health equity piece really resonated well across all of the messages, telling us that if we focus on community water fluoridation being equitable for all populations, that is a positive direction to take. I agree, this particular population, our sample population, did not include a lot of BIPOC, Black, Indigenous, people of color, but in the future, absolutely, that is a very good suggestion and one that should be looked into.
Well, and I know that a lot of the social media messages that we have they even have the other slide that shows a darker skin tone. And then again, we have them in Spanish as well. I would like to thank everyone for joining us today. And thank you, Dr. Josephine Wolf, for presenting all of this for us today. You did a great job, and I appreciate that. So thank you again, and have a nice weekend, everyone. We appreciate your time.